Indonesia's blood banks are running dry. Demand has gone up amid the pandemic. But coronavirus fears mean fewer people are heading to donation centres to give blood. Saifabari Ismail finds out how organisations are getting creative to keep the country's blood banks stocked.
This ambulance is on a mission. It's been dispatched to a remote village in Tangerang, some 20 kilometers west of Jakarta, for a novel blood donation drive. The COVID-19 pandemic has forced people to not only work, study and pray from home, but also donate blood from home.
Ini kegiatan lebih nyaman, lebih efektif juga kan di apa namanya, daripada kita pergi ke sana kan, nggak boleh keluar adanya dobrak ini, jadi door to door, dari rumah ke rumah langsung kayak gitu. Jadi kalau ini kan di lingkungan kita sendiri gitu kan, lebih nyaman seperti ini sih.
This door-to-door blood drive is an initiative of the Tangerang branch of the Indonesian Red Cross. Its blood bank started running dry in March, shortly after the COVID-19 outbreak was declared in Indonesia. The number of donors has dropped, partly due to fears of being infected at the donation center. The home blood donation program was started last year, but gained attention during the COVID-19 health crisis. It now contributes to about 40% of the total blood supply in Tangerang. That's gone some way towards easing the shortage, but more needs to be done.
Biasanya kita bisa menyimpan darah di sini di ruang kulturum itu sampai 5 hari masih bisa kita storage. Tapi sekarang ketika darah ini sudah diolah, itu langsung kita distribusikan kepada rumah sakit karena memang mungkin pendonornya berkurang, tapi untuk pasien itu tidak bisa berkurang, justru mungkin akan bertambah.
The Tangerang General Hospital, one of several COVID-19 referral hospitals, needs about 100 blood bags a day. Demand for blood has gone up during the pandemic, with COVID-19 patients who have underlying medical conditions needing blood transfusions too.
Seperti pada pasien yang dengan komorbid gagal ginjal atau memang ada anemi sebelumnya atau yang lain-lain atau terjadi DIC yang berat, mungkin memerlukan darah, yaitu baru.
At the Indonesian Red Cross Laboratory, staff work 3 shifts a day to ensure a consistent supply of blood goes out to the hospitals. Donors' blood is processed in this laboratory, which operates 24 hours. The blood is screened for 4 types of virus like hepatitis and HIV. It takes about just 1 hour to screen each sample of blood. The Indonesian Red Cross says the country needs about 15 tons of blood a day. Blood supply has dropped by about 30% since the pandemic struck, but the shortage has not reached critical levels yet. And in the meantime, it's pledged to continue finding new ways to reach out to blood donors to sustain supply and save lives. Saifabari Ismail, CNA, Tangerang, Banten.